Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we are on a mission to help each and every doctor with his or her career growth. And we do that by interviewing doctors from different specialities and understanding about their journeys, their struggles, and what they have learned during their experience. And especially today, we are very sorry for the complete delay of our live session. We are around 14 minutes delayed. There was some connectivity error in our connection. That is the reason. Really sorry for keeping all of you waiting. And today we have Dr. Sumant Mishra with us. He is a practicing pediodontist in the Ministry of Health, Kuwait, currently, with his long experience of working and learning and educating himself in different countries of this world, from Finland to UK to Italy and now in Kuwait. He's here to help us know about his experience, what has he learned about till now, and also about the job opportunities that the BDS and MDS, that is the dental graduates, can look forward to internationally. Welcome, Doctor, to the platform. It's really nice to have you here.
Thank you, Dr. Ayushi, and welcome all the viewers.
Yes. And, I'm sure, it's going to be such an insightful session today. So, let's start with a brief about your journey. How did it, unroll from the starting?
Yeah, so I will go into some finer details for our other junior colleagues and some of our colleagues to know the details. Currently, I'm working, as you rightly said, as a pediatric dentist in Ministry of Health, Kuwait, since the last 11 years. This is the 11th year. And basically, I'm a BDS, graduate from Maulana Azad Institute of Dental Sciences. Now they changed the name. So I'm a gold medalist dentist from Maulana Azad Institute of Dental Sciences. And then I went to Finland, University of Helsinki, Finland. I did part of my postgraduate certificate courses and with honors in University of Helsinki. Because it was non-clinical, I had the passion for clinical dentistry, to work on in clinics. So I went to pediatric dentistry in MCLIN Pediatric Dentistry in University of London. And from there, after getting my master's program, I moved to County Cumbria NHS Trust near Scotland. I worked there for almost 1 year in oral maxillofacial surgery, and then I'm here. So in between, I did my fellowship in Laser Dentistry from University of Genoa, Italy.
Yes.
So that's in brief.
Yes, and it's so much, that you have understood and learned, I'm sure, in your journey. And so, I hope that, many of our colleagues will be able to extract from that knowledge that you have gained till now. So let's understand about the job opportunities that you have seen that, dental graduates can look forward to internationally. Let's start from the, postgraduate people for MDS and who have just cleared the MDS and are looking forward to move internationally. What are the kind of job opportunities they can look forward to?
See, I have subdivided into like Gulf countries. Let's start with Dubai, Abu Dhabi, and Sharjah. These are the parts of UAE, United Arab Emirates. Correct. So we have in Dubai, we have exams like DHA, Dubai Health Authority licensing exams for the fresh graduates as well as masters. They have some assessment examinations, and once we pass the assessment exams, then there is they will get the eligibility letter, and then based on that letter, we can get the license to practice from DHA, Dubai Health Authority. This is to practice only in Dubai, because in UAE, all of them have separate exams. So Dubai has DHA, Dubai Health Authority licensing exam, and Abu Dhabi and Al Ain has HAAD, which is Health Authority of Abu Dhabi. This is also same, like we have to get the exams, and then after the exams there will be eligibility letter, and once they get the letter, within 1 year they have to find the job so that they can practice. And then Sharjah and rest have MOH exam, which is Ministry of Health. So Sharjah, Ras Al Khaimah, Ajman, these come there. So basically, exams, first of all, assessment examination, whether we qualify or not, based on our BDS or master's programs. And then they get the exams. After passing the exams, license to practice, and then find a job. All
Correct.
common.
Correct.
Talking about UK, our colleagues can find NHS jobs or BMJ jobs or BMJ career jobs. BMJ as in British Medical Journal. So BMJ careers or NHS jobs, National Health Services jobs. So there are a lot of, once we go to the website, there's a lot of jobs available. So even without clearing the licensing exam for UK, they can get the job, apply for the jobs online. Being in India, they can apply. And once they get the jobs, they get the acceptance letter. They can apply for their visa. And once they get the visa, and once they go there actually, then they will get temporary registration from the NHS, National Health Services. So government will give them temporary registration to work under the NHS service, that particular NHS hospital.
Okay.
They can work, let's say, 6 months, and then periodically extension for 1 year or 2 years based on their performance. And then in between, they can apply for their ORE exam, which is for getting permanent license to practice. ORE stands for Overseas Registration Examinations for Dentists, overseas dentists, which is further in 2 parts, like part 1 and part 2. Part 1 is written and part 2 is clinical. So basically, ORS does the ORE, Overseas Registration Exams, just the clinical skills and knowledge, but they don't have to mandatory clear it first. First, they can apply for the jobs, go there, work simultaneously. They can, in between, they can practice, and there are a lot of exams, coaching available there.
Correct.
And when they get into the system, they get oriented, acquainted with the local laws, and they will be more confident. In between, they can start for part 1 written and part 2 clinical examinations. Talking about USA, we all know about the National Board of Dental Examination, NBDE. So that is part 1, part 2. Part 1 having OSCEs, basically 400 MCQs, and from the basic sciences like study in first year, second year, human anatomy, embryology, histology, all those things, dental anatomy, occlusal microbiology, pathologies. Part 2, NBDA, National Board of Dental Examinations of USA, requires clinical. So all those operative dentistry, maxillofacial, diagnosis, also all those things. And for sure, before this, they need to get their degrees evaluated through ECE, Educational Credentials, or WES evaluation, which is World Education Services. The websites are available. Once they enroll for ECE, Educational Credentials, or WES, World Education Services, they will get their marks based on their USA system evaluated, and with that they can apply for MBDE part 1, part 2, and sit for the exams, clear the exams, and also take the TOEFL exams, and then apply for the US dental school programs if they wish. Or once they get the license to practice, they can practice. But also there, some of the states in USA have different bench tests. Also, clinical tests vary in the different states of USA. Talking about Canada, have different kind of exam than somewhat similar to USA, but it's like National Dental Examination Board of Canada, NDEB, which basically having written exams and OSCEs, objective structured clinical examinations, assessment of fundamental knowledge and core knowledge. About Australia has the Australian Dental Council, which regulates the foreign dentists, and they can, if they are eligible to apply for ADC, depending on their eligibility criteria, from which universities they will be verified online, and they have to apply for ADC exams, which is like initial assessment, and then same written and practical. So almost same structure. New Zealand basically New Zealand dental registration exams basically through the national and NDEB Canada. So same like Canada, is sit for Canada, and then it will make them qualify for national New Zealand registration also license.
Yes.
Or also this can come through Australian board also. So Australian board through there is some system about Tasmanian. So the one who are eligible to practice in Australia through the Australian Dental Council exam, they can practice in New Zealand as well. Okay, under Trans-Tasman Mutual Recognition Act. Okay, so Australia can get them through to New Zealand as well. Australia plus New Zealand both, and also Canada can get them both, Canada and New Zealand. So it makes life easy for them. Okay.
Yes.
So this is briefly about Australia, New Zealand, Canada, USA, UK. About European Union, there is one language thing. So we have to study language. That is the one. So maybe depending on the, like let's say we are going for Netherlands or Finland, Sweden, we have to apply for the exams, local language exams, which might take 1 to 2 years, depending on how we catch. How in between they can get some jobs different than the dentistry actually. Okay, but in UK, they can get, let's say, dentists can get oral maxillofacial surgery, max fax jobs easier as an SHO, senior house officer, rather than pediatric or orthodontics. They start with maxillofacial. When we apply initially, they say, okay, go for the basics. First, learn, go to the rotation, and start with max fax. So they start with max fax, get the experience in max fax, and then slowly, because pediatric and ortho are more saturated there. So they normally give us maxillofacial, where we cater to the patients, admissions and everything. And then we learn suturing techniques and everything, drawing up blood samplings, intravenous blood and all those things, and then theaters and all those things, inpatient, all those things. So this is briefly, and in, this is in brief overall.
Correct. No, that's nice to know about each and every country. But isn't this same for both MDS and BDS, the examinations?
Actually, you are right. Because for overseas, it's not like a computer engineer, with due respect, because they are dealing with machines, with due respect. Okay, so they have their format. We as medical professionals are not dealing with machines. We are dealing with human beings. So all the country, they will start checking us, because let's say I am putting anesthesia on to do the dental procedure on a let's say kid, pediatric dentist. So my technique has to be evaluated by them. My qualification has to be evaluated by them. So for that, they want to standardize, whether they are masters from India or they are bachelors from India. First of all, they want to equilibrate them, equivalency as per their requirements. So they are, whether our colleagues are masters or bachelors, first of all, they, Australian, let's say, or American, will try to evaluate them and make them standard according to their country's fresh graduates. And then they will see.
Yes. Also, I wanted to understand one thing. Is there any experience needed for people to apply before, for example, there are many just undergraduates after BDS want to go international and apply for examinations. Is it possible? As well as for postgraduates, is there any minimum experience needed for these examinations in general?
See, many of the UK and USA, they ask for 2 years experience post-graduation. How it helps? Because it will make your CV better and more strong. So you will improve your competitiveness as an applicant. Okay. So I suggest, I guide my junior colleagues to get their, let's say they are fresh graduates, get the internship. After internship, do something like, if possible, house surgeon, junior resident doctorship there. Let's say I did my internship in 2001, and then from 2001 to 2 I did house surgeon, junior resident doctor, and then I kept looking and then I went to WHO, and then all those World Health Organization in New Delhi office, and then I got the job from my own university. There was some opening, so I started working as a WHO research assistant associate. Okay, I also went to ICMR, Indian Council of Medical Research, and I got the scholarships to do some survey kind of thing in slum areas in behind the Times of India office, Valmiki slum areas. So there is a lot of options there. We have to look for the options, and I am sure the talent is hidden in Indian brothers and sisters. They are quite talented. Only thing, they have to tap their talent in a nice way, and they have to look out for the opportunities. They are scattered. We have to grab the opportunities, and everybody has the potential. Be optimistic and look out. I start looking for WHO. I start looking for ICMR in India, and then step by step from WHO, I applied for 6 universities. I got admission in 6 universities in USA, and then somehow visa was refused. That's another issue. Then I bypassed, and then I went to public health in Finland. So my brothers and sisters can do the same way. They can keep applying. Getting the experience in India will get them more competitiveness in their CV resume, and then better chances for acceptance in better universities. Also in job profile, let's say UK. If they have experience, they can adapt in an easy way, and easy chances of acceptance. In between, they can do TOEFL or IELTS. Let's say Australia asking for IELTS, or TOEFL for USA, UK. So they can give these 2 exams, which is valid for 2 years, and then side by side preparing for other exams and applying for the jobs. Keep applying. There is no harm. There is no harm, and they're UK, Europe, America, Australia, Canada. They're very accessible. They're very nice. They respond to the emails instantly. So don't feel shy. Don't hesitate. Apply. There is no harm. Yes or no. That's it. There's no harm. Keep applying. Keep moving up. In between, keep finding opportunities in the homeland. Keep working. Keep making your CV strong. Keep collecting nice reference letters from your professors, especially head of the departments, to make your CV resume more competitive, challenging. And keep doing volunteer works. It counts a lot. Believe me, trust me, it never goes in waste. Keep doing volunteer works, community services. Okay, so it counts a lot, especially when applying for overseas jobs or also masters.
So now, coming to this, when you just mentioned that there are multiple opportunities, you also, started searching and worked with ICMR, WHO, and hence you landed up in Finland working, for your certification course in healthcare quality improvement and leadership development. So now what are the other kind of opportunities that you have seen outside India that are easily available, that, for example, many a times, while preparing for the examination, for example, ADC, or, for the US examinations, it's always better to go there, start working and understand the environment there, and then applying for the examinations, because understanding in India, it's very difficult. What are the, standards there? So going as a dentist will be a bit difficult, I believe, if you have not cleared examinations apart from UK in the other countries. But what are the other kind of job opportunities that are good and are easily approachable to the healthcare professionals, that they can go and then subsequently apply for different universities and examinations?
See, talking about those who have done their master's programs, they can find it easier to get accommodated, especially in USA, some universities, as lecturers in teaching profession, which is better, because what happens in teaching profession, they don't need to have their dental license exams. They can get their university certificates and all those qualifications verified through the assessment skills, and then based on that they can be placed as a lecturer for taking because that in a lecture they are not doing invasive, let's say invasive treatment of a patient so that time they are exempted. once they enter into the university, teach the students side by side, they can prepare, because then they will learn about the local laws and local ethics and everything. So they will be more prepared for the exams step by step. Also, there's a lot of scholarships, teaching assistants, opportunities, especially in European and USA, UK also, but a bit conservative. Okay, but even in UK, let's say talking about UK, my consultant, my SR senior resident there that time, oral maxillofacial surgery. He was from Bangalore. I'm talking about 2008. Okay, he was doing excellent there in the job. He got a letter of acceptance from Oxford University for doing MBBS, like to be a consultant in maxillofacial surgery. We have to have oral maxillofacial surgery needs to be dual qualified, not only dentistry, also medicine.
Yeah.
And 3 years was waived. It was only 2 years, and he got very concessional rate university fees, same like almost UK graduates, same like British nationality. So once we go there, we can get a lot of openings which they don't see from outside. When they are sitting in India, it's difficult. Once you reach inside, then many of the opportunities open, and or liaise with the university professors. They are very nice to help, and then they see the caliber. Prove your caliber 6 months, 1 year, and either you can switch from the job to your exams, or you can shift on the to do the master's programs also, depending on the priorities. And to be honest, Indian graduates are well respected, as far as my experience is concerned, in Europe, in UK, in even in Gulf countries. Anabi Hindi doctor. I want Indian doctor.
Okay.
Everywhere here, even here, and even in UK, Professor Alan Boyd. If you see, he's one of the pioneer in SEM, scanning electron microscope SEM studies of enamel, human enamel. If you see any SEM studies on human enamel, Professor Alan Boyd, he was my mentor.
Okay.
Was doing MCLIN in London University. So he himself acknowledged, this is way back in 2006. Indian graduates are best because their basic training is very nice as far as his assessment. So we are looked in high. Only thing, we have to be a role model, and we have to be confident, and the potential is there. Indian professionals are hardworking, honest, and the basics are very nice. Only thing, just have confidence, go for it, make liaison, think about Vasudhaiva Kutumbakam, what we learned from Sanskrit. I am Nija Paroveti Ganana Lagutyasam Udar Chiltanam to Vasudhaiva Kutumbakam. World is like a family. So go and conquer.
Yes.
They are waiting for you. They are waiting for the opportunities.
Correct. So, that's really nice to, for the teaching opportunity you just mentioned. There is one question by Dr. Malvika. She's asking that which of the exams are a bit economical for graduates as compared to US and UK, which are very expensive.
I cannot say exactly about the amount right now, but to be honest, challenging, both of them are challenging.
They are actually expensive. She mentioned that UK and US exams are very expensive. Are there any other country exams which are a bit economical and, which are not very heavy on pockets?
See, when we go to USA, UK, these countries are, she's right, expensive, not only in these exams, even living there, cost of living, and even if you do some other courses there. Australian little economical, but I cannot say exact figures. Canada also expensive. Australian, New Zealand little economical as compared to these three. UK, Canada, Australian, New Zealand little cheaper, economical. Okay. But then we think about what's investment. So it's like once you get it, return of investment. But yeah, you are right. She's right. initially we have to think about these things as well. You're
Yes.
right. You're right.
Yes, but if you start working on some job along with that, maybe that can help you. But initially, it is difficult.
See, to be honest, let me put, this reminds me, let me put in this way, UK, talking about UK, because I stayed there for almost 5-6 years. So if she works, hopefully she gets a job at SHO in one of the NHS services, 1 month salary will go in part 2. So think about that. Don't convert it to Indian rupees. If we start convert it into Indian rupees, then it will be like psychologically a bit challenging. But if we think about our earning there, okay, 1 month salary and return also. So she starts working as an SHO, okay, keep getting the salaries. By the time, keep preparing for the exams. 1 month salary will be the part 2 exam. Part 1 is more economical of ORE, overseas registration exams. So this is, I'm talking about UK because I have stayed there personally.
Yes.
So 1 month salary will, so like return of investment.
Okay. So, think positively that you will, clear and your 1 month salary will be paid off.
Yeah, you're right.
Yes.
Because when we are where we are living, we have to think in that way. Most of my colleagues from India, they start calculating in Indian currencies, but then they get psychologically depressed. No, it's too much. But when they start, okay, live in present, we are earning in UK, we are earning in Kuwait. So I'm asking them to calculate in Kuwaiti currency. Okay, then it's cool. Okay, one hour salary, one month salary. Okay, my job is for 1 year, my job is 2 years, I'm saving. Okay, so think in that way. Try to distract your mind, behavior shaping, behavior managements or distraction techniques. So somehow try to get the positives out of it. And once they get the license to practice, nothing like that.
Correct, you're absolutely right. So in fact, there is one more question from her. She's telling, is there any country where we can work directly after BDS?
As we just now discussed, all the countries, we are doing invasive treatment in their citizens. Correct. In their human beings, not like a machine. With due respect, with due respect to the professionals from engineering, IT, they are working on machines. With due respect, they are dealing with software, hardware. We are dealing with human beings. So anything I'm doing on a kid, let's say pediatric dentist, I'm encroaching the body, the biology of their human beings. No government will. No government will want overseas dentists coming and invading their biology of their citizens and playing with that, with due respect. Okay, so maybe they want to evaluate. For that, there is an licensing examinations. Okay, maybe some adjacent countries, like I'm not sure about Nepal and all those things, bordering countries, I'm not sure about them. Maybe little easier there. But talking about these big countries, UK, USA, Canada, Australia, New Zealand, European Union has language barrier. Correct. So good question. Thank you for her.
Yes. So is there one more, we have one more question by Janvi. She's asking, are there any job opportunities after public health?
Excellent question. I missed this point. I want to tell this. Very nice question, doctor. So when I went to Helsinki, I was thinking about, because I got MPH, which is like a healthcare quality improvement and leadership development. Right. So equivalent to MPH. I was trying to see in that way. Clinical was a bit challenging that time. And then I shifted to clinical later on.
Yes.
After MPH, the scope opens and they're bigger than the clinicians. They go to the higher level, like talking about administration or talking about, let's say, WHO, World Health Organization, talking about working in United Nations, UN, talking about Red Cross Society, talking about MSF, Medicine Sans Frontier, all those big opportunity opens. How she or he, how they tap, how our brothers and sisters tap is unlimited. After public health is unlimited. They can go to higher authorities. They can do many things. A lot of volunteers, a lot of things, a lot of fundings are there after MPH. More. So very good question. I missed this point. Thank you for reminding me. Excellent. But too many opportunities.
Glad to know about that. Actually, this is a very pertinent question. And so, how can they apply on? So, they should look forward to bigger organizations like WHO and bigger NGOs, or there are any other job opportunities that they should apply for.
See, let's say I'm working in Ministry of Health, MOH. In UK, I work for NHS, National Health Services. In India, I work for Indian government. So I talk about working in big institutions, not like, with due respect, private clinics. So I talk about bigger umbrella. So like what you're saying, WHO, United Nations, MSF, Medicine Sans Frontières, Red Crescent Society, Red Cross Society, these are bigger umbrellas. These are bigger umbrellas, and under them, the job security and the recognition is very nice. They are renowned world over. So it's not about pay, it's also about pay plus perks. So perks. So we get a lot of perks and remunerations and name and fame that comes, which cannot be compensated by simply money. With due respect, I know it's priority many times, so priority changes, I understand.
Yes. No, that's true. That's definitely true. So now, shifting to some other part of the discussion, you have done a fellowship in, laser dentistry as well as from Italy. So what are the other kind of fellowships that people can think of going for after, after their post-graduation and undergraduation? This is something that many dentists are looking forward to for their higher qualifications. What is it that you think are good fellowships and are there internationally that can help them to grow?
Yeah, so basically the things, those fellowship which are helpful in their clinical practice, let's say talking about implants. Okay, I did this laser dentistry because that time I thought my ministry will allow me to practice laser dentistry in ministry, but this is one disadvantage. If you are in private practice, with due respect, and if you are ministry is a bigger umbrella. I understand, and I said it. But another thing, you cannot apply everything. You have to be dependent on the structures and hierarchy and the things they approve. But in private, you ask your boss and immediate contact, and then they can approve you, and we can practice immediately. So depending on their priorities, let's say they are working in implants clinic, or some of the clinics for general dentists, they need somebody like multi-purpose dentists. So a dentist who can do root canal, a dentist who can do implants, crown and bridge. So there are a lot of bridge courses, or the course like I did, laser dentistry upcoming. So this is very beneficial for working in private setup, because private setups, the management looks for your generation of the income, how you generate the revenues for them. So they will be very much obliged for you if you do courses like implants fellowships, or laser dentistry fellowships, or things like that, bridge and anterior cosmetic dentistry, which is a good source of revenue for them. So for sure. So these are the different fellowships available online. They can check, and many courses are there.
Okay, that's nice to know. So now, you have been working in Kuwait. So just wanted to understand your kind of lifestyle here in Kuwait, and, with different countries as well. What has been your lifestyle? What are your, good points, as well as what are the challenges that you faced during these years working internationally?
Yeah, very good question. Very interesting question. Individual variations, 5 fingers are not the same. So what I see from the brothers and sisters and my respected teachers and my parents, mom, dad, who played a very important role, and my brothers there, and many colleagues there whom I cannot name also. But I learned to be more flexible. I learned to mingle, to come out of my bubble, come out of my own bubble, come out of the well, and then go out, mingle with them. Local culture, try to know the local culture and implement this local culture into practice, and liaise with them. So when we liaise with them, then it makes our life easy, and they start knowing about our culture. Many times where we live in our own bubble, in our own cocoon, so we we don't understand their culture, and they don't understand our culture. With this, lot of barrier comes into play. And what I learned from my post-graduation certificate courses in University of Helsinki, Finland, is to remove the filters like pride, prejudice, attitude, assumptions, expectations, self-image. So I don't have self-image. I leave this image outside. I don't have ego. We have to leave this ego. I know it's very easy to say, very difficult to implement, but the more we refine ourselves on a daily basis, it can be done. So filters like pride, prejudice, attitude, assumptions, expectations, self-image has to be removed, and go out and mingle with them. The world is a family. Go out, they are welcoming you in with open arms.
Okay. Okay, that's really nice to know. But still, there must have been some difficult points. Just, the idea of discussing here is so that if somebody wants to plan to move internationally, there is some mindset that they have in mind, that you just mentioned, that you need to be you need to learn to move out of your bubble is an amazing thing that you just mentioned. Is there anything else that person should have in mind when he plans to move out?
Always respect the local culture, always respect the local law. Let's say if the law wants us to be a bit conservative, there is no harm. We respect the laws. The law expect us not to drink. It's fine. We have to adapt ourselves accordingly, depending on the priority. So local law, respecting the local laws, culture also. And many challenges comes here. There is a lot of psychology. Simple example. The parents come here. Being a pediatric dentist, we get not only the child, but let's say we say buy one get one free. So it's like a package. So I'm, with due respect, I'm not talking about buying or something. With due respect, when we get a small kid, we are treating under 6 years of baby, like 3 years, 4 years. The youngest baby I treated was 29 days, okay, for natal teeth. So they come as a package. They come with mom and sometimes dad both, and we cannot refuse for underage. We cannot refuse both of them, because a lot of scientific research done. They come to the conclusion that especially mom's attachment with the babies 2 years, 3 years, 4 years is necessary. So we cannot remove them from the clinics. So they start saying something because of the culture, and then they see, okay, this doesn't. They start getting misconceptions. I talk to them politely, I explain the procedure nicely. Still they have confusions. But one word I say, Oladat misal oladi. Your baby is like my baby. The moment you say this, trust me, where there is language barrier, where there is cultural barrier, they start hugging me and saying nice word. So coming out of the bubble and telling them that your baby is like my own baby, they cannot believe it. They get shocked with in a positive way. So for sure, we have to respect the law of the land, local law, local authorities, and the culture as well. I'm talking about coming out of the bubble, also thinking about our safety.
Yes.
Not that we are going just like that and forgetting about safety. Try to analyze, try to venture. Another incident I remember in Finland, people from our country, with due respect, our brothers and sisters, they are saying Finnish people are rude, they are arrogant. I want to remove this myth many times. So because what happened, our brothers was thinking these guys are not talking, they are just reading every time, let's say in transport system, okay, or in the metro and trams and everything. So I tried to break the barrier, break the ice. I went there, approached them, I talked to them, and I indirectly asked this question to them, to the Finnish people. Finland citizens are called Finnish. So they said, no, we are not rude, we are not arrogant, we are just shy. So see the perspective, psychology. I am not talking to them, I'm thinking they are rude, they have stiff upper lip, they have high nose, but they are thinking we are shy, they are shy. So we have to come out, we have to approach. We are not harming them, we have to think about our safety as well. So misconceptions can be ruled out by this way, approaching.
That's such a nice incident to know that you just mentioned. So, you know,
Never ever rosy picture. Sorry, there
yeah,
might be more challenges depending on, but you have to see like SWOT analysis: strength, weakness, opportunities,
correct,
threat.
correct,
But within limits, we have to play around these things. And ultimately, human psychology, you praise them nicely, talk to them in a nice way. You can get the body language, you can understand the verbal non-verbal communication skills, you can understand whether he or she is getting a bit challenging to us, then we stay off, no problem.
correct, correct. So there is one more question by Dr. Malvika. She's asking how to apply for government NGOs like MOH, NHS, etc. exams. Is it directly through agencies or directly from the website?
To be honest, just as I said about the UAE, United Arab Emirates, I told about some of the DOH or MOH exam. There is website. There are websites for UAE, United Arab Emirates, but some part, like let's say Kuwait and some parts, have agencies working. Because I tried to talk to the Kuwaiti, they didn't have the. I came through somebody,
Hmm,
and I can guide my brothers and sisters to the
hmm,
right person. But to be
hmm.
honest, in this here, Kuwait, they don't respond to the emails more. So here it's more about physically coming and distributing the CVs and the. But in UAE, there are sites,
And
websites.
regarding
There is more.
NHS and all, UK.
NHS, NHS, as I told, I think maybe Dr. Malvika missed it because it was early. We told about bmjcareers.com. BMJ is British Medical Journal, and NHS Jobs. So she can find a lot of jobs. NHS Jobs, depending on the area, there are a lot of jobs. Jobs,
Hmm,
NHS Careers, or BMJ Careers. So
hmm,
she can get the jobs from their
hmm.
websites. Yeah.
Dr. Meena is asking that if if I'm a British dentist, do I get preference over the local dentist?
If I'm a British dentist,
Do I get
I will get a
preference?
preference over local dentist.
Yes.
So she's in British and she's a local dentist.
Yes, I believe,
So
I'm also confused with the question. So she
yeah,
has written this. Yes,
yeah.
yes.
Many of the job offers, many of the job advertisements in UK, they say non-European Union will
Hmm.
be taken only if European Union or British citizens or European Union are not there. Or
Correct.
so they prefer EU citizens or UK citizens
Hmm.
over non-European Union. So they, in the priority, they take first British citizens and
Then
then European Union, and only if there is vacancy, then they will take non-European Union.
correct.
Good
Correct.
question. Thanks.
Yes. Thanks. Thank you, sir, for the complete insightful session. Let's end this on a high note. Actually, sorry, Dr. Meena just mentioned that she's looking to migrate in UAE and she's being
Okay.
registered with the GDC UK.
Yeah.
So does she get preference looking to migrate to UK? She's a British dentist. She's looking to migrate to UK and or UAE. Does she get a preference on that?
So if she applies for UAE, let's say, she
Hmm.
has to go to the websites of MOH, Ministry of Health, or those things I mentioned in the initial stages, DOH, uh, and then they will ask for the assessment. They will ask for all the certificates from her.
Hmm.
It might be easier for her,
Hmm.
being a UK citizen and graduate. It might be easier for her. How much easier? Maybe they will waive off written examination.
Hmm.
They will just see the CV and immediate placement. So it will be easier for her, sure.
Okay.
And good
Okay.
luck to her.
Yes. Yes. Yes.
To
That's
all of you, to be honest, all of your viewers, all the brothers and sisters here.
yes. Glad to know that, sir. So actually, let's end this on a high note. Some motivational quote from your end that has motivated you always, and I'm sure will motivate the students and our colleagues here in India who are planning to move internationally.
India has the potential to be the world leaders, and all my Indian brothers and sisters, all the curricular BDS curriculum in India is very strong. The basis is very strong.
Hmm.
So we just need positive outlook, optimism, and self-confidence.
Hmm.
Go and conquer the world. All my brothers and sisters, go, and the world is open for you, waiting for you. Just have self-confidence, follow the law of the land. Don't give anybody any points to point fingers at you. You'll be the world leaders. So you have the potential. Just arouse, awake, wake up. You have the potential, and the world is yours.
Correct. Correct. That's so true. Thank you so much, sir, for joining us at this time and guiding us in such a right way in with your experience and your journey. I'm sure this has helped many people out there and will continue to help many of our colleagues who watch this interview again. Thank you so much, everyone, for joining us at this time. I'm sure it might be helpful for you listening to such an insightful session. Do share it with your friends and colleagues. They will also get guided in the right direction if they're looking for opportunities to move international. Do follow us on our YouTube and Instagram channel to see all our old videos that may also help you with your career growth. Thank you so much, sir, for Dr. Sumant for joining us right now.
Thank you, Dr. Ayushi, and you're doing an excellent job with this nice platform to help our brothers and sisters. You're doing excellent job for the humanity. Really appreciate. Hats off to you and all our viewers. Good luck for all of you.
Yeah. Okay. Bye-bye. Good night, everyone. Good night.
Good night.